I've been around for 30 years, and I don't think at that time I ever thought that I'd be getting up and speaking as a director of a healthy ageing program, because I've worked on HIV for most of my career. But Rob's quite correct and Arnis is correct that some of the projects that we've done at the Burnet actually wouldn't have even got started. They simply wouldn't have happened if we hadn't had some community support. And a good example is the CD4 test that I developed with David Anderson, who also works here. And that was a test basically trying to work out how we could allow people who lived in resource-constrained countries to gain access to life-saving medicine for HIV infection. You needed to have a particular test that told the government that your immune system had been damaged enough by HIV in order to become eligible to the drugs. And it was a catch-22, because what would happen would be that people couldn't afford to have the very fancy test that needed to be done, so therefore they wouldn't get access to the drugs. So we developed a point-of-care test that looked a bit like a pregnancy test. It's taken a long time for it to be developed and then to be licensed to a company in the UK. But now we've actually had our first validation studies completed in both India and South Africa. And so it's a real achievement. We're really proud of it. It's not quite as fancy as having twin girls, but it is certainly a product of the Burnet Institute. And that just wouldn't have happened if we hadn't had a bequest that got us started on that about 10 years ago. But today I'm going to be talking about the Healthy Ageing Program, which is a new program, a new initiative that was seen in the vision of the board of how the Burnet should be evolving. As I'll explain to you later on, many of the causes of death around the world globally used to be infections, and that's becoming replaced, if you like, by the fact that diseases normally associated with ageing, such as cardiovascular disease, so heart attacks and strokes, cancers, diabetes, are now overtaking infections in many parts of the world. So it was the vision of the board that we should start a new program called the Healthy Ageing Program. And I'd already been doing some work on this because we've known for a few years through our work and the work of others that people who have HIV infection actually prematurely age. They develop early, these diseases of ageing. So the fact that we've now got fantastic drugs to treat HIV infection and people don't die from AIDS very commonly now, but what is happening is we're seeing in the clinic where I work at the Alfred an increasing number of people in their 30s and 40s coming in with heart attacks and with diabetes and with cancers. And that's because HIV confers a risk on the development of these age-related diseases to about the same level as smoking, about a twofold risk. So therefore, I've been very interested in ageing, and I'm looking far beyond what happens just with HIV infection. We're looking now at a much larger program at the Burnet through this Healthy Ageing Program. So our goal with this program is to try and make sure that individuals, particularly the vulnerable communities that we work in, have access to processes that allow healthy ageing from birth and improved physical, mental and social well-being throughout life. Now, the important things there are that we're looking from birth and we're looking at what happens throughout life. And that's where our program differs, because many programs that are involved on ageing these days look to see what they can do just when people have achieved a certain age, and they try and make their life healthier after that, or they try and work out ways, the researchers are trying to work out ways that you can halt the ageing process. And certainly we're interested in that as well, but we're moving right back to what's happening early in life, and that's what I'm going to tell you about in this story today. The MacArthur Foundation Network on Ageing has also defined successful ageing by 3 criteria, and I think we can all relate to these. It's the avoidance of disease and disability, it's the maintenance of high cognitive and physical function, and it's engagement with life. So it's much broader than just making sure we don't get diabetes or have heart attacks. So our objectives, I think, look at this fairly closely, and I'm not going to bore you by going through these in great detail, but I'm just going to give you the 3 main objectives of the Healthy Ageing Program. We want to make a major contribution to understanding the biology of ageing, as well as the psychosocial environmental factors that affect ageing. So we're keen to look at how infections that we deal with already at the Burnet, such as HIV, hepatitis C and malaria, can actually affect the ageing process, and also cancers and other immune disorders. We want to know how exposure to drugs, how environmental toxins, and how poor nutrition, even in infancy, can also affect healthy ageing. We also want to promote inclusive services for healthy ageing, and I'm not going to get into whether we should be voting yes or not, but you can probably guess from my attitude that it's really important to make sure that all of the people that we work with and care for, including the LGBTI community and people living in neighbouring countries, that we provide evidence for policy relating to the process of ageing and develop inclusive models for the population we work with. So vote yes. And we also want to contribute to the development of new tools and therapeutics for diseases that are associated with ageing. So how do we define healthy ageing? Well, it's, the fancy thing is it's the development and maintenance of optimal physical, social and mental well-being and function throughout life. I draw attention to the fact that the program that I'm directing is not just about old people, although a lot of the work that we do also relates to these non-communicable diseases and diseases associated with ageing. But this ageing process actually starts during infancy, during pregnancy, and adverse early environments can predispose infants to a much higher risk later on for developing the so-called diseases of ageing. So what happens here, and I haven't got a pointer, I'm sorry, can influence what happens in later life. And there's a hypothesis that was put forward about 25 years ago by David Barker, and he was a British physician. And he put forward the hypothesis that poor nutrition during pregnancy and in infancy would lead to an increased risk of cardiovascular disease, high blood pressure, diabetes, and problems with your cholesterol levels. And in fact, he's been proven to be spot on. And what's also interesting is that it's not just poor nutrition during pregnancy and infancy, but it's also later exposure to a more affluent society where you might then have more to eat. And that is the ingredient, the major ingredient for developing these so-called diseases associated with ageing. There's a long list of all the things that happen during ageing, but let's just look at a few. These are little factoids that if you play Trivial Pursuit, they might come in handy. But did you know that teenagers lose their childhood ability to hear high-frequency sounds above 20 hertz? So that's right back as a teenager, the ageing process is starting. Cognitive decline actually begins in the mid-20s, so that's when you should start doing Sudoku. After the age of 20, we produce 1% less collagen in the skin per year, and that's how we all get wrinkles. And after peaking in the mid-20s, female fertility declines. Now let's fast forward, we'll go through some of the middle years. Did you know that if you're in the 60 to 65 year bracket, you've got a 53% chance of having osteoarthritis? And did you know that if you actually get to 75 years, you're more than likely to have hearing loss that affects your communication? And if you reach 80 years, more than 50% of you will have a cataract. So this ageing process occurs right through life. And what is the evidence actually that it influences by what happens early in life? Well, many of you might know the story of the hunger winter, or the hunger winter, the famine, the Dutch famine that occurred during 1944 and 1945, about the time that Germany took possession of France, Luxembourg, Belgium and Holland. And so what happened was that the Germans, the German occupied part of the Netherlands, which is mainly the western part of the Netherlands, food became very scarce because the Germans banned food export into the country, and then the canals froze. So there was no way that food could reach the western part of Holland. And even when this German ban was lifted, there still was not sufficient food. And there were something like 4.5 million people who were affected. 22,000 are estimated to have died, and the ones who survived as a result of access to soup kitchens with food rations that were around 400 to 800 calories a day. There are actually nearly 2,500 babies who were born in Amsterdam during the Dutch famine, where there were very detailed not only birth records, but then their records during their development. And so these people were invited back when they were aged 50 and again when they were aged 58 to participate in a study. And basically it was a study that was aimed to see whether David Barker's hypothesis that undernutrition during pregnancy and infancy would relate to a higher risk later on of having cardiovascular disease, diabetes, cancers and other diseases of ageing. And unfortunately, this was an experiment of nature that actually was proven to be correct. And exposure to the famine during the pregnancy or infancy was associated with later development of heart attacks, diabetes, high cholesterol, obesity, what we consider to be age-associated, or now the new term to describe these is non-communicable diseases as opposed to infections. So there's very clear evidence that maternal undernutrition during pregnancy has critical effects on the health of the child in their later life. Also, we now know that poverty is closely linked with poor adult health. And what seems to be surprising is that as a country becomes more rich, has more access to food, etc., that there is an increasing risk of having heart attacks. But if you look closer at that, it's the people who are in the lower socio-economic class within that country that have the highest risk of heart attacks, etc. So it's not just exposure to cigarettes and unhealthy food, it's really having this social disadvantage that increases your exposure to cigarettes and unhealthy food, poor access to medical care, which increases your risk of age-associated diseases. And whilst we might say, well, okay, that's all right, not all right, but this is happening outside Australia, in fact, we know that it's also happening locally. And there's been a fantastic study just recently published through the University of Melbourne and the Royal Children's Hospital, where they've looked at socio-economic status and they've looked at the onset of puberty. And what they found was that puberty occurs up to 5 years earlier in a child who grows up in poverty. This was a large study of nearly 4,000 children. And those who were born into disadvantaged homes, 1/3 of both the boys and the girls had early puberty. Not part of this study, but other studies have shown that early puberty is very closely linked to the later risk of heart disease, strokes, breast and prostate cancer. It's no secret that the world's population is ageing, and in fact we're on the brink of a demographic milestone. I think it's really interesting that since the beginning of recorded history, young children have outnumbered their elders, but that's about to change. And by 2020, the number of those who are 65 years or older will actually outnumber those who are less than 5 years of age. And this just shows you this graphically. In red, you can see the age of children who are less than 5 years. In blue, you see the age of adults who are aged over 65 years. And the red dotted line shows you that in 2020, the blue line is going to be higher than the red line. So there'll be more adults aged 65 compared to children aged less than 5 years. Let's break that down into a few numbers. Globally, in 2010, there were about 500 million people who were aged over 65. If we fast forward to 2050, that number will be 1.5 billion. So let's now look at the predicted global impact of these demographic changes. I love this quote from Richard Suzman. He's from the Suzman family in South Africa who were anti-apartheid. They were a family of politicians. Richard Suzman moved to the United States and worked at the US National Institute of Aging. And one of his most favourite or most famous quotations is that ageing is reshaping our world. Like climate change, it seems inexorable and gradual, but the global impact of ageing on health, disability, well-being and poverty might eventually turn out to be as profound for society as rising temperatures. And what's also important is that some countries will grow old before they grow rich. Those same numbers again, 500 million people aged greater than 65 in 2010, rising to 1.5 billion by 2050. But if you look between those years, in the less developed countries, who've really had less time to adjust to this increase in their ageing population, there'll be a 250% increase in elderly. Whereas in the developed countries like Australia, where we've had decades to start adjusting, there'll be a 70% increase. So the sheer numbers of ageing people will challenge national infrastructures, in particular health. If we just focus for a start on China in blue, we can see that in 2010, 110 million people were aged more than 65. That will increase to 330 million. If we look in India, shown in green, 60 million in 2010 will rise fourfold to 230 million. So the ageing populations are going to have a huge effect on how our governments are going to have to deal with their health dollar. I hinted early on that the reason why we've formed this healthy ageing program is because Burnet and the Burnet board recognised just what the transition that is occurring globally. These improvements are part of a major global health transition with a decline in birth rates, coupled to a steady increase in life expectancy at birth, and a shift in the leading causes of mortality from infectious diseases to these non-communicable diseases or age-associated diseases. So we're facing what might be called the Silver Tsunami. As life expectancy improves, it's important to think, will this be spent with longer times in poor health? We don't want that, okay? No one wants to live longer but be disabled and not to be able to enjoy life. Will this be the price of unhealthy lifestyles? And that's where part of our work at Burnet comes in, to try and see if we can look at unhealthy lifestyles from birth and see if we can be an instrument of change. There's certainly evidence that people in their 30s and 40s in the developed world are in worse shape than a generation ago as a result of an increase in obesity and diabetes. I'm just going to finish by showing you some of the early work of the Healthy Ageing Program. A little bit. Now, our programs now, why they're so important to Burnet, is that they're making sure that we link everybody across Burnet. It's not just the scientists working in a silo and the public health researchers working in their silo. We're all working together across projects and programs that are considered to be important for the mission for Burnet. So one of the Healthy Ageing Program's objectives is to contribute to evidence regarding the biological determinants of ageing. These non-communicable diseases or diseases associated with ageing that I've spoken about. I'm sorry, we've got a problem with the graphics there, but we want to know why we have a higher risk of getting these diseases and why these occur as we age. Well, the link between the biology of ageing and age-associated diseases has always been, people have been trying to work out what is that link. And work at the Burnet, as well as with our colleagues elsewhere, have shown that the lifetime accumulation of exposure to pathogens, environmental toxins, stresses, poor diet, contributes to the development of inflammation. And inflammation is critical for the development of all of these diseases associated with ageing. What we're interested in is what triggers that inflammation, and that's work that's ongoing at Burnet now. And there are some clues from our early work in the laboratory that there are mediators of inflammation within the cells, and these little mitochondria that live in the cells, which are the powerhouses or the energy producers in the cells, are likely to hold that key. They direct the energy in the immune cells to produce inflammatory proteins. We've shown that with HIV infection as an example, but it is being shown by others to occur more broadly than that. So this would appear to underpin the risk for age-associated diseases, and now the biology of ageing is one of the foci of research at Burnet. Just to talk about another project that's ongoing within our program, the program, this objective being to promote inclusive services for healthy ageing. Fred Hollows and the Burnet Institute came together a while ago to collaborate on a program in Sri Lanka, which was called the Better Vision Healthy Ageing Program. And this program has a goal to improve the health, vision and quality of life for elders, not just in Sri Lanka, but across the region. What's important about this program is it's research within a development program. So we were keen to see if work that we could do to prevent blindness could be coupled with a program to do research on seeing how the development of these what's called elders clubs, where health promotion would be part of that, might provide an important link. This Better Vision Healthy Ageing program addressed the existing need for glasses, cataract surgery and other eye health care services. We brought in surgeons from other countries to work with the locals to try and provide them with the training that they required to look after the eye health of these elders. And this was all done in the setting of elders clubs that were developed for eye screening and health promotion activities. It was done in a part of Sri Lanka that's in the central part of the country. It's Tamil community. These people had been exposed to a lot of discrimination. There was a lot of problems with alcoholism, other social problems there. It's a sort of program that Burnet embraces because it's our vulnerable communities that we like to try and reach out for. And the program was a success. It addressed the backlog of cataract surgery, it addressed the queues for spectacles, it strengthened the skills of eye healthcare workers. The health promotion aspect encouraged screening, referral and follow-up and support for the visually impaired. It also raised awareness about the prevention of these non-communicable diseases, of which eye disease is just one. And the research measured the impact of the elders clubs on health-related quality of life. This work is going to go further. I wish I could say it's actually happening, but we've just had our first meetings with the Hollows Foundation for a further collaboration, and we want to take this work into Myanmar. So I'll be able to give you an update next time we meet, hopefully. So my last slide, just finishing by saying that ageing is one of the most important challenges facing society and governments at present, and we're very pleased that Burnet is now going to be part of the work that will help to tackle how we can address healthy ageing right from early childhood, aiming to improve physical, mental and social wellbeing and function throughout life. That being the key difference for our program compared to a lot of other healthy ageing programs. We're doing this by working with the scientists to understand the biology of ageing, working with our community health workers, our public health workers to provide better services and influence policy relating to ageing, particularly for the vulnerable. And we're developing tools and therapeutics, hopefully similar to the one that I've told you about, this CD4 test, which we've now been able to trial in India and South Africa. We want to develop novel tools which will be useful for predicting the development of age-related diseases. Thank you very much.